This video is on Medicaid cuts. Today is June 29th, 2025. I'm going to compare what's the difference between the House version of the budget bill regarding Medicaid cuts versus the Senate's version. Now, as you know, the House's version passed, so it will be at least what the House says, and the Senate's version has not passed as of this moment. Now, the Senate has more deeper cuts to Medicaid. You might want to save this video because I am going to go rather quickly in order to get all of this information down in 10 minutes. I've already tried to do it in 10 minutes and failed, so I'm going to have to move a little quicker. I've done all the research and I have bullet pointed and outlined everything for you. I'm going to read what I have to go quicker for you. Now, the first topic of Medicaid cuts is work requirements. This is true in both the House and the Senate bill. For anyone who's on Medicaid between the ages of 19 and 64, you will be required to work 80 hours per month. If you are not working 80 hours per month, you will be required to participate in qualifying activities 80 hours per month. They have not defined what those qualifying activities are. We can guess that it's going to be most likely like college or something to that effect. When they do define it, I will share that. Now, who is exempt from working who is on Medicaid? In the House bill, parents of dependent children are exempt from working. That's parents of dependent children under the age of 18. Those who are medically frail do not have to work if they're on Medicaid. That's elderly disabled. In the Senate bill, it's different. Of course, the medically frail, as they term it, elderly disabled, do not have to work. However, parents of dependent children ages 14 and under do not have to work. If you have a child age 15 or higher, you do have to work. You have those work requirements. Another work requirement for those applying for Medicaid, you have to prove that you have been working for one or more consecutive months preceding the date of your application. For those already on Medicaid who are in the groups of people who are required to work, you have to prove one or more months between recertification periods, which will happen twice a year, and that you're working 80 hours per month. So you'll have to prove that twice a year, that you've worked at least one or more months. They have not defined what more months means. It has to be consecutive. That's in the House bill. In the Senate bill, same exact requirements, except the Senate wants a cap on the lookbacks for applicants to 3 months. So when you're applying for Medicaid, they won't look further back than the past 3 months, and you do have to have that 80 hours a month of work consecutive for those months. In both the House and Senate bill proposals, if a person is denied Medicaid, or if they're disenrolled, kicked off Medicaid due to the lack of work requirements, not following the rules with the work requirements, you are also ineligible for subsidized marketplace coverage, which means you will be paying full price for your health insurance. And the effective date of all of these work requirement laws that I just shared, not later than December 31st, 2026, but every state can choose to make that date earlier. That is in the House and Senate. Eligibility determinations for Medicaid. Number 1, recertification. Now you get recertified once every year. But the House in their bill wants to require states to do it every 6 months. The Senate is the same. So regardless, you will be required to recertify every 6 months. The effective date, the House wants it to start for renewals on or after December 31st, 2026, while the Senate wants it to start 180 days after the bill is enacted. Verifying enrollee address and other information on your application or recertification for Medicaid. This is the next topic. Now, states aren't required to verify your address to be on Medicaid. That is going to change. The House bill and the Senate version of the bill are the same with regards to this topic. Now, states will be required to obtain an enrollee's address information using reliable data sources, including the National Change of Address Database and managed care entities. Basically, that means they're going to use all avenues and resources to make sure you live where you say you're living. They're also going to use every avenue and resource to make sure who's living in your household and their income is what you say it is on your application. DHHS will also establish a system to share information with states. This is to prevent people from being enrolled in more than one state simultaneously, and it's to prevent fraud. The effective date for the verifying enrollee address and other information on the application is January 1st, 2027. That's for states to obtain contact information and verify that. And then October 1st, 2029, for a new system to be established to prevent any fraud from happening, and for information to be shared across systems. Retroactive coverage is the next topic of Medicaid cuts. Now, under the current law, Medicaid covers medical expenses up to 90 days prior to your application date. Now, the House bill, they limit the retroactive coverage to 1 month prior to the application date, effective December 31st, 2026. In the Senate's version of the bill, they limit the retroactive coverage to 1 month prior to the application date for expansion enrollees and 2 months prior for a traditional enrollees, effective January 1st, 2027. I'll keep my eye on that and let you know, but either way, it's going to be limited. This is a big one, cost sharing. What's coming out of your pocket? Both the House and Senate bills eliminate enrollment fees or premiums for expansion adults. Both the House and the Senate bills, states will be required to impose $35 charge for service on expansion adults with incomes 100 to 138% of the federal poverty level. That's what your income has to be. Primary care, mental health, and substance use disorder services are exempt from cost sharing. You will not have to pay a copay for primary, mental health, or substance abuse services. Now, out-of-pocket expenses cannot exceed 5% of the family total income. States may allow providers to deny services for enrollees for non-payments of copays. All of that is in the House and the Senate bill, so that will all occur. That effective date is October 1st, 2028. The Senate bill also permits cost sharing for non-emergency services provided in a hospital emergency department to exceed $35. So the Senate is saying hospital emergency rooms can charge you more than $35 if you have Medicaid for services. I have to speed it up. I got 2 minutes left. Free choice of provider. Now you can choose, go to any provider organization you want that accepts Medicaid. That is no longer going to be the case. Both the House and the Senate bill say this, and this is what it's going to be. Medicaid will not be used at any nonprofit organization. Essential community providers primarily engaged in family planning services or reproductive services cannot be used at a facility who provides abortions like Planned Parenthood or any other community providers. None of those you will be able to use your Medicaid anymore. Effective date upon enactment, and it will be effective for 10 years. Finally, gender affirming care. Both the House and the Senate agree on this. There will be no federal matching funds for gender transition procedures, including puberty blockers, hormone treatment, and surgery of any individual of any age enrolled in Medicaid and CHIP. If you have Medicaid and CHIP or CHIP, you're not getting any of those services. Effective date upon enactment, when the bill and it is signed, which will be soon, and there will be no end date on that. Now, this is a lot to absorb. Again, you might want to save this. I appreciate you being here. If you have any questions, you can always ask in the comments, or you can message me, and I will answer them to the best of my ability. I'll research more if need be. Thank you for being here. Please like, follow, and share so that I can continue to provide you with more content.